I want you to take out of my presentation, other than the policies of the World Health Organization in health research, is that research and innovation builds nations. And that poverty of research costs lives. When I looked at the contribution of Africa to global health research, you will see, for instance, between 2000 and 2011, out of 756 new medicines registered, only 29, 3.8%, were focused on addressing the problems of Africa. (3.8%). Yet Africa has 37% of the world's population, 24% of the global burden of disease, and only 1.3% of published articles. What is the problem? Poverty of research. In 1971, nearly 50 years ago, I lost my stepmother to cholera. Surprisingly, 50 years later, cholera is still killing people in Africa. This year, this very year, there's been cholera, I believe in Tanzania, in Kenya, in Somalia, in Eritrea, acute watery diarrhea in Ethiopia, in Uganda, various parts of Africa. The same cholera that killed my mother in 1971 is still killing people 50 years later. Why? It should not be so. Poverty of research and innovation. By now, we ought to have had medicines that can prevent cholera, that can cure cholera. As a very young doctor, in 1988, I was the only physician in a clinic. And we had a total of 50 cholera cases. 50. 48 of them died. Not cholera, yellow fever cases. They were all bleeding from the nose, from the mouth. Most of them died. 2016, we still have cholera cases, DRC, and parts of Africa. Why should it be so 40 years later? Poverty of research for the problems of Africa. August 2014, I was asked to go to Liberia as part of WHO's search capacity for Ebola. Lest we forget, many died. I remember Kakata Health Center in Magibi County of Liberia. I remember Nurse Jane. As always, she took care of the sick in her home. But this time, the person she took care of was Ebola infected. She became sick. She went to her health center for care. Her friends surrounded her and managed her. 21 of them, all but 2 died in that health center. That was the most depressing day of my life. And they are women. They are health workers. And they died. Ebola is relatively an ancient disease. Why was there no cure? Why was there no vaccine? Poverty of research in Africa. That's what I'm saying. These are Africa's problems. Appropriate medicines are not there. We are not undertaking development-focused research to solve our problems. And I said I want to encourage you. Looked at from the other side, this is talking about the central role of the researcher. As small as you are, as big as you are, in your hand lies Africa's solution. Even if you have to use your family resources to test that idea, and I pray that the private sector, the governments will invest in research. The future of the continent depends on researchers and innovators, playing with ideas, looking at the things that were settled before, perhaps the other ways of looking at them. That is why, in looking at how to move forward research in Africa, we looked at what is the problem. And we realized that a major factor is insufficient investment by governments, by foundations, by the private sector in our continent. We realized that the curriculum for training researchers is inadequate. And we are having problem retaining even the researchers that are trained in Africa. And we do not blame any of the researchers who goes to the West. Because first and foremost, you have a family to take care of, and you have a career to build. But these were looked at in the context of developing a WHO research strategy for Africa, which was adopted last year. That strategy has defined 5 interventions. The first is health research governance. What can we do as governments and people in Africa to strengthen governance, to ensure that development and implementation of national research policies, plans, and priorities are in situ in our countries? The strategy also proposes the setting up, the maintenance of functional national ethics committees. In intervention 2, focus on human and infrastructural resources of academic public research organizations, like supporting the establishment of research units in various centers, creation of clear research career development paths, and providing incentives to attract and retain professionals in research areas. Intervention number 3, producing and using health research results. When I was in Kenya, which is where I met Professor Vulule, the colleagues who were researching in malaria, there were many research publications, but it occurred to us that there were didactic researches, which is very good, but many of them did not discuss the policy and strategy implications of the findings. The policymaker in the Ministry of Health wants to know your opinion on the implication of your finding to national development, be it health or any other part of national development. The Minister of Health, for instance, directors and policymakers, they want to know what is the implication of the finding. And so we asked for national research policy meetings to be able to begin to interact to ensure that researchers understand the needs of policymakers and policymakers understand the challenges of researchers. I believe that that meeting is still going on in Kenya every 2 years, just to ensure, but it was for malaria, it needs to be for the entire sector. That is the area of the challenge of ensuring that our researches impact on policy. And therefore, using results, WHO has provided in the strategy the establishment of a knowledge translation platform such as Evidence-Informed Policy Network, which should have the capacity for stakeholder analysis, disease priority mapping, and stimulation of demand-driven research. Intervention number 4, ensuring adequate and sustained funding for health. We are proposing and we are hoping to support advocacy for taxation schemes that will support research in our countries. We are proposing and pursuing through advocacy with governments and leaders pooled funds for research in countries and pre-competitive research platforms and milestone prizes. And then in intervention 4, that is what I've been talking about. And finally, intervention 5, we are proposing establishment of mechanisms for tracking research investments within countries. The reason is because promises have been made in the past. Governments and foundations, perhaps it's time working with the research community to track the investments and hold ourselves accountable. Without innovation, we believe that we are doomed, and that the way forward is to support research and researchers to be innovative, to research and find solutions to the problems that concern us. And that is why in WHO Africa, we have set up the Africa Advisory Committee for Health Research and Development that advises our office on research priorities in the region. We've also set up the Evidence-Informed Network. And then finally, there's a consultative expert working group on health research, financing, and coordination. The aim of that is to develop innovative ways to fund research and development for interventions against diseases that affect our continent. As part of this strategy, we are also providing direct technical support to countries, meaning through the Ministry of Health, and then small catalytic grants for young researchers. And finally, there has been an effort to coordinate several researches in the region. But as I leave you, I want to repeat again, Africa has many problems. Africa has been called by several names: the dark continent, the diseased continent, the sick continent. To change that appellation depends on research and innovation, which is why you are here, and that's why we are grateful to UNESCO and Merck for this forum, which they are supporting, and we hope they will keep supporting in future. Because bringing researchers together, encouraging especially the young researchers to invest time and energy in looking at solutions to the problems that concern us, that confront us, is the way to the future. That is the way of innovation. That is the way of finding solutions to the problems we confront. Thank you very much.